Thank you everybody for joining us today for this webinar about all that you need to know about monkeypox. I am Dr. Manisha Jutani. I'm the Commissioner of the Department of Public Health. Thank you for your patience. And I see that we have over 250 participants. I really appreciate all of you waiting all this time to be able to get in. This was looks like nationwide Zoom crash with 10,000 different vendors having problems with Zoom. So please accept our apologies. I know that our team worked very hard to do a dry test run, which worked fine. So sometimes technology is out of our control, but we are all here and you all waited to hear what we have to say. And I truly appreciate that you all are here to listen to Dr. Sosa and to interact with us at the Department of Public Health. She is going to go through a lot of details that are very, very important and I think will be useful to all of you. What I want you to know as the commissioner is that we are extremely committed to getting control of the monkeypox epidemic that is happening right now in Connecticut. And so far, I know that people have concerns about who is affected, how is this transmitted, and importantly, people want access to vaccines. And I understand that concern. We will be addressing all of that. What I do want you to know is that we are remaining nimble and agile to be able to adjust to based on what we receive as allocations from the federal government. And this is literally changing every day. So my commitment to you is that so far we had been prioritizing people who were specific contacts, but starting Monday, we will be able to roll out vaccines to a broader group of people. And our goal is to get as many shots in arms as possible, partnering with as many clinics as we can, and to really broaden the number of people that have immunity within the state of Connecticut to monkeypox. So again, I appreciate your patience. I'm going to turn this over to Dr. Sosa because I want to maximize our time. Many people may have commitments at 2. And Lynn, I will turn it over to you for the discussion.
Great. Thank you, Commissioner. I'm going to show my slides. All right. Can everybody see my slides? Yes. Okay, great.
Yes.
Okay, excellent. Thank you. So today, as the commissioner said, we want to make sure that we're covering a bunch of things, but in particular, these are the things that we want people to know. So what is monkeypox and who is it affecting? What does monkeypox look like and how do you get tested? Are there treatments for monkeypox and how can someone get vaccinated against monkeypox? So before this current outbreak, what did we already know about monkeypox? So monkeypox is actually not a new disease. However, it has been a rare disease. Before this current outbreak, it has been known to be endemic, meaning it is found in West and Central Africa. It's caused by an orthopox virus it's called monkeypox because that was the original animal it was found in. We actually don't know which animals this virus usually lives in, but we think it's small mammals. And what we knew about monkeypox before this current outbreak is that it can spread from infected animals to humans and also person to person. And the ways that it could spread was through respiratory secretions, through skin to skin contact with infected body fluids, and that's fluid from vesicles or pustules, but also through fomites or sharing materials like towels and bedding. The incubation period, which is how long it takes someone to get sick once they've been exposed, is 4 to 17 days, but the average is 5 to 13 days. One good thing about this virus is that someone is not contagious until symptoms begin, and we'll talk a little bit more about that. So our experience with monkeypox before the last couple of months has been primarily focused on people who traveled to parts of Africa where this virus is more common, as well as related to exposure to mammals that had this virus. So what is new about monkeypox? So starting in May of this year, we started hearing of reports of large numbers of cases in European countries where monkeypox had not previously occurred. These cases were associated with people who are attending large parties and raves, and were primarily affecting men who have sex with men, bisexual men, and other men who have sex with men. And so what is new about monkeypox is that it is currently being spread primarily from skin to skin contact, including close, intimate, or sexual contact. So far, there are over almost 17,000 cases in 74 countries, and the World Health Organization has declared monkeypox a global health emergency. Monkeypox in the United States, as of yesterday, there are over 4,600 cases. And based on an available subset of data that the CDC has, the median age of persons affected is 35 years, with the range 18 to 76 years. And just like the rest of the world, the majority of cases are among men who are identified as sex at birth, and men who have sex with other men. The racial ethnic breakdown is 45% white non-Hispanic, 35% Hispanic, and 15% Black. And you might have heard that there were 2 cases identified in children last week. However, there have been no deaths in the United States or in Europe related to these current cases. In Connecticut, we first identified our first case of monkeypox on July 5th, and since then we've had 28 cases reported to us. Just like the rest of the country and the rest of the world, all of the cases in Connecticut are in persons who identify as men, and almost all of them identify as men who have sex with men. The median age is 36 years. Most of our cases are among men aged 20 to 49 years. We've had cases reported from 5 different counties. Half of our cases identify as white race and a third as Hispanic or Latino. So what does monkeypox look like? And I wanted to just show a few pictures about what we are seeing when it comes to monkeypox. And so these pictures here actually are coming from cases that have occurred over the last couple of months. And so what you're seeing here on different parts of the body are what is described as firm. So when these lesions are actually pressed, they can feel hard. That means that they're deep seated. They're kind of really kind of in that skin. They're usually well circumscribed, meaning that they're discrete. Like you can tell from these pictures that there's different lesions. And sometimes they're umbilicated, meaning like there's a little dot in the middle. The challenge with monkeypox is that it can look like other things, and there are multiple stages of the virus. So this is this one that you're looking at here are pustule-like. They can look like vesicles, and they can look different at the beginning of the infection versus the end of the infection. So one of the things that we have been doing since the beginning of knowing about monkeypox is making sure that healthcare providers know about what monkeypox is and what it looks like and how you can test for it. So for monkeypox, you can only be tested if you have a rash or a lesion. So this is different than what we're used to with COVID-19. And again, the good thing about this virus is that people are only infectious once they've had symptoms. Many people will develop what we call a prodrome. So they might have a flu-like illness before they get the rash. But it is only when someone actually has a rash that we can actually swab and take parts of what is out of that lesion and get it tested that can actually test people. So we want people to be tested if they have a rash that looks like a monkeypox rash. We want to test people that have a rash that has had known close contact that has monkeypox. Someone with a rash that has had close or intimate contact with someone in a social network where monkeypox is spreading. And certainly people who have traveled to another country where we know monkeypox is spreading. Since June, our state public health laboratory was the first laboratory to offer monkeypox testing in the state, and has also been offering specimen collection kits to all healthcare providers in the state, so they are able to have the supplies they need to test. Since that time, 5 commercial laboratories have come on board and can offer testing. So this means that testing is available to any healthcare provider who sees a patient. That any healthcare provider can swab the lesions and send it to either the state public health laboratory or any of the 5 commercial laboratories. It is important to remember that results will come back to the healthcare provider and they provide it to the patient, not the laboratory. So what should you do if you have monkeypox? And so these are the things that we want people to keep in mind if they do come down with monkeypox. So it is really important that people stay home until their rash is fully resolved. And what that means is that the scabs that eventually form on these lesions have fallen off, and there's a new layer of skin under that. Unfortunately, this can take several weeks, an average of 2 to 4 weeks. So that means we don't want people to leave their home unless, of course, they need medical care or have an emergency. And if they do, we want to make sure that they're calling ahead to make sure that the healthcare providers know that they have monkeypox, so they're ready to help them. We want persons with monkeypox to avoid close physical contact with others, especially in the house. So if they are in a household with others, staying in their own room, using their own bathroom if it's available, wearing a mask if they have to be in close contact with others, and not engaging in sexual activity that involves direct physical contact until that rash is healed. Because we know that monkeypox can spread from contaminated items like bed linens or clothing and towels, we don't want those to be shared. And because we're concerned about pets in the home or other animals potentially getting monkeypox, persons who are sick who have pets should not be caring for them. So what can people do to protect themselves from monkeypox so that they don't get it in the first place? And so I think the first thing is being aware of any new or unexplained rash on your body or a partner's body. And this includes the genitals and anus. And if there is a rash, seeing a healthcare provider as soon as possible. As I said before, some people with monkeypox might have a flu-like illness. They might have a fever, they might have a cough or a sore throat before that rash comes out. We can't test somebody for monkeypox then, but it is still really important that folks stay away from other people and see their healthcare provider in that situation. And then if someone has a rash, especially if it looks like a rash of monkeypox, people should avoid close skin to skin contact with those people so that they're not coming in contact with those rashes or scabs. That means not kissing, hugging, or cuddling or having sex with somebody who could have monkeypox, and not sharing bed or linens or utensils. And again, not handling or touching the bedding or the towels, sex toys, things like that of somebody who could have monkeypox. So there have been a lot of questions about condoms, and condoms can help, especially if the rashes or sores are confined to the genitals or anus, but it is unlikely that condoms alone are going to be enough to prevent monkeypox. And again, limiting your sex partners could reduce the possibility of being exposed. So another question that comes up is, are there treatments for monkeypox? And actually there are, which is a good thing. So the main medication we have for treating monkeypox is called tecovirimat, or TPOXX for short. This is an antiviral that was developed and approved originally to treat smallpox. However, it can be used for monkeypox. And the treatment considerations for using this medication is especially for people who have severe disease. This includes people who have disease in sensitive parts of the body that could be painful or cause bleeding or other complications. And there are people that are at high risk for severe disease, including people with HIV or certain skin conditions. So these are absolutely the people that we want to be considered for TPOXX. So TPOXX is considered an investigational drug. As I mentioned, it was originally developed to treat smallpox, but we are using it for monkeypox. So as a result, there is a whole process that needs to be followed, including a patient understanding the risks and benefits and signing a consent form. However, the protocol for this was just streamlined by CDC to make it easier for providers to provide. And in Connecticut, for the last several weeks, we have made sure that TPOXX is available in the state to help providers start their patients on treatment as quickly as possible. So what vaccines are available for monkeypox? So there are 2 vaccines that are available. I'm going to start with the Jynneos vaccine, which is the vaccine currently being allocated to Connecticut. This vaccine is in limited supply, which is why the federal government has been only giving out a certain amount at a time. This vaccine contains a live virus. It is not the monkeypox virus, but you cannot get monkeypox from the vaccine. It is administered as 2 subcutaneous injections 4 weeks apart. and a person is considered fully immunized 14 days after the second dose. This vaccine is currently only able to be given to persons who are over 18. If somebody is younger than 18 who needs to be vaccinated, there is a process that we can go through to do that. The effectiveness against monkeypox of this virus is supported by animal studies. And the good thing about this vaccine also is that there are not a lot of adverse reactions. So usually it could be pain or swelling or redness at the place where someone is vaccinated. And it is important to note that this vaccine is safe to give to people who have HIV and atopic dermatitis. The second vaccine that is available is called ACAM 2000. This vaccine has a lot of additional considerations. So it is not being used right now, but we are working to identify healthcare providers who are interested in administering this vaccine. But we wanted to explain some of the caveats of this vaccine. So this vaccine is actually a live vaccinia virus vaccine. So again, this is not the same virus as monkeypox. However, the thinking is that this vaccine provides immunity that can also work for monkeypox. So this vaccine is administered as one dose, but with a special needle, and providers need to be specially trained. This is not a usual way that we give vaccines. Once someone has been vaccinated, a lesion will actually form at the site of the vaccination. That's called a take. And that's actually how we know that that vaccination was successful. However, this lesion can cause some illness, and it can take 6 weeks or more to heal. The immune response after this one dose does take 4 weeks. So it takes 4 weeks to be fully immunized. And just like the Jynneos vaccine, this vaccine is licensed to be used against smallpox. However, it is being allowed to be used against monkeypox under a special IND. So again, it's an investigational use, which requires informed consent and a process that needs to be followed. The effectiveness of ACAM 2000 for monkeypox is supported by both human clinical trials and animal studies. But unfortunately, there are more potential adverse reactions related to this vaccine. So in addition to the sites where somebody is vaccinated, people can have fever, rash, or other complications from this vaccine. And this vaccine cannot be given to everybody, and in particular, should not be given to persons with immune compromise like HIV and several other medical conditions. So we are focused on the use of that first vaccine I was talking about, that's the Jynneos vaccine. And so how can we use this vaccine? So there are 3 ways that this vaccine can currently be used. Post-exposure prophylaxis. So that is also called PEP. And that is when we are giving vaccine to a person with a known exposure to a person with monkeypox. And this is the work that public health is doing when we interview persons who have been diagnosed with monkeypox to understand who they could have been in close contact with since they were infectious, since they were sick. The vaccine can be given up to 14 days after exposure to prevent illness, but is best given within 4 days of exposure. So it's really within those first 4 days that we can do our best to prevent illness, but giving it up to 14 days could still be effective in preventing and actually making illness less severe. So because most of these exposures are being identified through public health are the ones that are making these referrals, and public health will also be monitoring persons who are considered close contacts to make sure they aren't getting symptoms. The next way the vaccine can be used is for expanded PEP, or what we are calling PEP++. And so the idea here is that we're trying to identify persons that have risk factors for exposure to monkeypox, and people who could have been exposed but don't necessarily know it for sure. And then finally, there's pre-exposure prophylaxis. And the way that pre-exposure prophylaxis is currently being used is identifying people who could be high risk for exposure to monkeypox. And so far, that exposure has been confined primarily to laboratory workers. So trying to make sure that the persons that are testing all of these specimens being sent to the laboratory for monkeypox are vaccinated. But right now, broad pre-exposure prophylaxis is not recommended at this time, but is something that can be considered in the future. So in Connecticut, this is going to be the eligibility criteria for monkeypox vaccine. So as I mentioned before, the highest priority are persons who are identified by public health as being close contacts to someone who has tested positive for monkeypox. And this has been our focus for the last several weeks. And these are the persons that we have made sure that can get vaccinated, who want to be vaccinated. Starting Monday, as the commissioner said, people who meet the following criteria who are Connecticut residents will also be eligible to be vaccinated. This includes gay, bisexual, and other men who have sex with men and or transgender, gender nonconforming, or gender binary persons, and age 18 or older, and have had multiple or anonymous sex partners in the last 14 days. If someone meets all of these criteria, we especially want people to consider being vaccinated if they've had partners that are showing symptoms of monkeypox, even if they have not been confirmed, people who met their partners through online or social media platforms or attending large parties or gatherings, or people that have conditions that may increase them risk for severe disease from monkeypox. It is really important that people understand that people who have monkeypox, people who have monkeypox right now, or have had monkeypox over the last couple of months, likely have some protection against another infection, and they are not eligible to be vaccinated at this time. So over the last several weeks, we have been working really hard to set up a monkeypox vaccine network. And I am very grateful to the 15 clinics that we are showing here who have agreed to be the administrators of vaccine. In addition, we are working with 4 hospitals who will be holding the vaccine and then distributing it to the clinic partners to make sure that they can have that vaccine as quickly and efficiently as possible. And you can see here, we have a broad range of clinics participating, and our goal was to make sure that vaccine would be available geographically throughout the state. And so we're very happy that we're able to do that at this time. As the next couple of weeks evolve, we'll be working to expand the clinics that are participating in our network. And then finally, I wanted to review what the vaccine timeline has been in Connecticut. So on June 28th, the federal government announced that there was going to be an allocation approach to the Jynneos vaccine. So as I mentioned, there is a limited supply. And so the federal government decided that they were going to take charge and start giving states vaccine based on both the number of cases that they had, as well as an estimate of the at-risk population. And unfortunately, on June 28th, Connecticut got 0 doses of vaccine. At that time, the timeline we were given was that we would be given allocations throughout the summer, with us not actually expecting most of our vaccine until the end of August. The good thing is that the federal government has been able to accelerate this timeline. And so on July 8th, we were notified we were receiving 635 doses. And then 1 week later, July 15th, another 1,143 doses. So we were not expecting that. However, we were already working to set up the vaccine network that I just showed, so that as of last Friday, we were able to make sure that all of those doses were delivered to the hospital depots in Connecticut. And starting this past Monday, we have already started distributing vaccine to the clinics. And I am happy to report we are already engaging with these clinics in making sure that persons who need post-exposure prophylaxis can be referred. Which means that as of, in addition to this, we have heard that our phase 3 allocation, which we were not expecting till the end of summer, is actually coming any hour, I think, in the next day or two, which is really why we were able to quickly pivot and expand access to vaccine on August 1st, on Monday, to that expanded PEP plus. And as we hear what our additional allocations are, we'll be working to make sure that there is as much vaccine available to the people that need it in our state. So DPH over the last several weeks has been working on educating providers, community providers, and the public so that they know about monkeypox. We have a dedicated monkeypox website where all of our information can be found. Our state public health laboratory was the first laboratory in the state to offer monkeypox testing, continues to do so, as well as continues to make sure that specimen collection supplies are available to any healthcare provider who needs it. And now that is in cooperation with 5 commercial laboratories serving the entire country. We have been facilitating rapid access to TPOXX by pre-positioning medication in the state and making sure providers know how to access it, as well as how to go through the special investigational drug process. And now we are able to implement a network of clinics to ensure rapid access to vaccine for eligible persons in Connecticut. So thank you for listening, and I think we have some time for questions.
Yes, thank you so much, Dr. Lynn Sosa. Hi, everyone. My name is Santi Gennaro, and I work in health communications here at the Connecticut Department of Public Health. And like the commissioner said, thank you so much for staying with us through this Zoom crash that happened through a national level, it seems. So a couple of questions that came in. We can start from the top. Does the monitoring period reset if exposure is continuous?
So yes, so I think this in terms of when someone is considered a close contact. So the period of time that it could take someone to get sick from monkeypox once they're exposed is 21 days. So for that 21 days, we want people to make sure that they're monitoring their symptoms. And in the first 14 days, if they have not been vaccinated, making sure that they start the vaccination. So they would get their first dose and then get a second dose 28 days later. So if someone is getting continuously exposed right now, then it would be continually monitoring and making sure that they don't have symptoms. But that's why it's really important that that's really why it's so important that we're now able to get more vaccine to more people who might be getting exposed at multiple locations.
Got it. Thank
Can
you.
I just follow up with one additional comment, Dante, which is that if you identify that the person that you're having continuous exposure with has monkeypox, you should stop further contact, so that the 21-day period is from the point of last contact going forward. Otherwise, that 21 days will keep extending longer and longer to your point of last contact. So it's important to stop once you know.
And that is a great question, because there are certain circumstances where you may be exposed from multiple people even. And so getting re-exposed that second time to the person's question, it would reset that. So great question. Thank you. And thank you, Dr. Chutani. What are your thoughts, Dr. Sosa, about cases of congregate settings like higher education?
So I think just the first step is making sure that any healthcare providers anywhere, doesn't matter if it's in higher education or anywhere, know about monkeypox, are familiar with it, are hearing about what the risk factors are, so that they can make sure that they're testing somebody who might present with a rash that looks like monkeypox, and especially if they happen to be in a group that where monkeypox is spreading. So I think for higher education and really for anybody, that's really the first step, is making sure that the healthcare providers are aware of monkeypox, but then also making sure that their students and other people are aware of monkeypox, especially their students who might be part of these groups where monkeypox is spreading.
All right. A couple of people were wondering if we'll be able to provide the slides for today's presentation.
Absolutely, yes.
Excellent. I do know that we are recording this, and following the presentation, we will be uploading it onto the DPH YouTube channel and putting a link onto our DPH Monkeypox webpage. And underneath that, I will be sure to include a link for the presentation that you're all seeing today. Great. More questions about presentations. Everybody wants your presentation, Dr. Sosa, which is great. Can Can a monkeypox positive person reinfect or further their spread of sores by reusing contaminated linen?
That is a good question. I will be honest, I don't know, but certainly I think we would want, first of all, someone who has monkeypox we wouldn't want other people in the household to do their laundry, because we don't want other people exposed. And I think it's just a matter of making sure that they're keeping it clean and everything like that.
Another question was, is the Genios vaccine the one that is safe for folks living with HIV?
Yes, it is. And that is one of, I think, another important reason why that is the vaccine that we're using right now. The ACAM 2000 vaccine cannot be given to anybody with HIV.
And again, somebody was curious about monkeypox being similar to smallpox. To reiterate, it is the same virus or related to this.
Right. So there's in a similar family, which is why, a lot of the treatments and vaccines that we have, which were originally used for smallpox. And again, to be clear, there is no smallpox anywhere in the world right now, which is really good. So that is why we're able to use those other treatments and vaccines, because they're in the same family, but it is not the same. And actually smallpox is a totally different disease. It's much more severe, and we're very happy that it no longer exists in the world.
Excellent. Someone asked which live virus is used in the Genios vaccine.
So I cannot answer that question. I know that it is the vaccinia virus in the ACAM 2000 vaccine.
Okay. This is a great question. If monkeypox can be spread by skin-to-skin contact and the virus does not care about sexual orientation or sexual activity, does the state plan on allowing folks who are not LGBTQ men to be tested and vaccinated who are close contacts of known cases? Say, for example, they said massage therapists, partners of people.
Yes. Right. So the answer is yes. So certainly anybody that has a rash that could be consistent with monkeypox can be tested. There is no restriction on people being tested, which is why it was so important to get those other laboratories on board. But yes, certainly if somebody is identified as a close contact, it doesn't matter who they are, what their sexual orientation is, or anything like that. They're going to be prioritized for vaccination.
Can I just make one comment, Dante?
Of course.
My understanding is the Genios vaccine is a replication deficient live vaccinia virus vaccine. So the same virus as is in ACAM 2000, but it can't replicate. That's why it's safer for people with HIV. That's my understanding, at least.
Thank you, Commissioner.
Do you need a special kit to swab, or can you use a standard viral culture to swab a lesion?
So we have specimen collection instructions on our monkeypox website, which are specific for the state public health laboratory. However, can actually be used by anybody. So it gives direction on the types of swabs that can be used. So for example, it's a dry swab. It can't be a cotton swab, but it can be certain other types of swabs. So often a swab that a clinic might already have. And it also can be a viral transport media is also the other swab that can be used. So these are common things that a lot of clinics already have. What's really important is that the healthcare provider, and they're used to this, they should know whatever the requirements are for the laboratory where they're sending the test. But we do have kind of general instructions specific for the state public health laboratory on our website. And then healthcare providers should check with the laboratory if they're not using our state lab to see if they have any different instructions.
Okay. And with the theme of testing, I know that it has to do depending on the volume, but do we currently know the turnaround time for getting test results back from the state lab?
From the state lab, so the state lab, their goal is to test as many specimens as they can up to their capacity based on what they've received the day before. So right now, the state lab's turnaround time has been quite good, usually about a day.
Wonderful. What are the four
Um,
hospitals?
I'm sorry, Dante, sorry. Just one other thing though, for the commercial labs, for providers in the community, my understanding is that for most of the commercial labs, it's more 2 to 3 days. Dr. Sosa, correct me if I'm wrong, but I believe that for most of them, they're sending it to one specific lab. It might be in California, it could be somewhere else. So for the commercial labs, it's a little bit of a longer turnaround time.
Okay, good to know. How long does the vaccine last?
So that is a good question. And I think that we're still going to learn more about the vaccine and how effective it is in this situation. So right now, the recommendation is that people receive the 2 doses. So it's 28 days apart, and then no additional vaccine after that. And I think we have more to learn about how long the vaccine is effective in preventing people from getting sick.
Excellent. What are the four hospitals that will be giving out the vaccine?
So I want to be clear that the hospitals are serving as depots, or basically storing the vaccine specifically for the clinics, the 15 clinics that are actually giving the vaccine. So that's really important for people to understand. So the hospitals are storing the vaccine. They are actually not giving the vaccine, although they could give it to, say, a healthcare worker who was exposed to somebody with monkeypox. So right now, the 4 hospital depots are Yale New Haven, Hartford Hospital, Danbury Hospital, and Day Kimball Hospital.
Excellent. Thank you for that clarification. For those who have received an initial dose in another state, what is the best process for getting the individual scheduled for their second dose?
So we're going to work really hard to help those people get their second dose. And we will be working with the clinics, but I think the best thing for them to do is either to call their healthcare provider, and then they can call us, the local health department, to get them referred.
Okay. If someone is previously immunized, yes, against smallpox, would ACAM 2000 create a take lesion or work, for that matter, if vaccinating someone, say a healthcare worker who's on the front line?
So that is a very specific question that
Yes.
I am not sure I can answer. What I can say is that if somebody had smallpox vaccine in the past, and some people have gotten it if they are old enough to have gotten it when we were still vaccinating everybody, that happened until the early 70s, or persons who might have gotten it as part of their job or something like that, and they're exposed now, they are recommended to get 1 dose of the Jynneos vaccine. So that I can say. I unfortunately cannot answer that exact specific question, Dante, that you asked me.
Okay. Someone else said that you had recommended wearing a mask. What is the current consensus regarding respiratory transmission, droplet versus airborne, and spread within households? The person would like to know your impression of the saliva testing that is being done in some laboratories in California as well.
Okay, so let me start there. So I know that there is work ongoing about evaluating how well, and I believe it's actually a throat swab for monkeypox. And I think the idea there was that we might be able to identify people a little bit before they have their rash. So that is still under investigation, and that is not something that is widely available, but I think we'll get more information on that soon. In terms of how monkeypox is spread, and that is something that is different and new with the outbreak that we're currently experiencing. Almost everybody that is getting monkeypox is getting it from close physical or sexual contact. So it's really requiring that close, prolonged contact. As I mentioned, we know from our previous experience with monkeypox that there is a possibility of respiratory spread. But again, this is not something that's just casual. This still involves that really prolonged close contact of respiratory spread. But that is also why when somebody does have monkeypox, they are recommended to wear a mask until their lesions and their rash is totally healed, because there is a concern for that. However, I think even in a household, the risk is still primarily from that close contact, that close prolonged contact, sharing towels and things like that. And again, we're talking about close contacts who might share beds or other things. So again, they have more opportunity to maybe come in contact with that rash and to have a prolonged respiratory contact.
Great. What is the process for referring patients to the identified monkeypox vaccination sites?
So for persons that are identified as close contacts and need post-exposure prophylaxis, those referrals are going to come from public health to the clinics, because there's two reasons for that. First is we want to make sure that those people are prioritized because they're our highest priority for making sure they get vaccinated. So we want to make sure that we're making that direct referral as opposed to that person just calling and saying, I need a vaccine. So we want to be sure that we're making sure those folks are prioritized. In addition, these folks, as I mentioned, need to be monitoring their symptoms for 21 days after that exposure, and the health department can help check in on them and make sure they're doing okay. And if they develop symptoms, make sure that they get tested or get referred for testing. So making that connection is really important. If someone is identifying themselves, say their partner told them, say, hey, I have monkeypox, you need to know about that. That's really great. That's what we want people to do. And in that situation, they can call their healthcare provider or call us, and we will help to make sure that they're referred. For people starting on Monday who fall into that eligibility criteria I laid out, so they're Connecticut residents, 18 and older, a man who has sex with men, and has had multiple or anonymous partners in the last 14 days, those but don't know for sure that they were exposed, those people can call one of the 15 clinics to make an appointment, and we will be making that information available in the next day or two.
Excellent. That's great, because we actually had a couple of people asking questions
Yes.
about the process for signing up for the vaccine.
Exactly. So it's really important that people don't just show up to the clinics. The clinics will have their own, every clinic will be slightly different in terms of how they do this, but it is by appointment only. That is really, really important. So people really do, once we make those that contact information available, it's really important that they call and not just try to show up.
Now, you mentioned, I believe earlier, that healthcare workers who have also been exposed to a potential monkeypox patient, are they eligible for the PEP?
Right.
PEP as well?
So we are certainly working with healthcare facilities when a person with monkeypox is identified. So the first thing is that we've shared with healthcare providers what the appropriate personal protective equipment they should be wearing when they're evaluating somebody who could have monkeypox. And so we've shared that information, but also when somebody has been identified, and we'll walk through that with the healthcare facility or the healthcare provider to walk through the scenarios. And if they fall into a high risk or intermediate scenario, we would offer them vaccine.
Excellent. Regarding the monkeypox vaccine and people who have been previously vaccinated, a couple of people would like to know, are people who've been previously vaccinated for smallpox still protected? And if so, how long does that last?
Right. So I think we know that that somebody's immunity to with the smallpox vaccine is likely to wane a little bit over time. So I cannot say for sure how long somebody is protected, but that is why the recommendation is that if somebody had smallpox vaccine before and is exposed now to monkeypox, they still get 1 dose of vaccine, of the Jynneos vaccine, instead of 2. And that's considered like a booster to kind of get their immunity level back up.
Excellent. Just going through a couple of these questions. A lot of people are interested in the contact information for the vaccination clinics, and we said that we'll be getting that out soon.
Yep.
Do we have any knowledge on how long people infected with monkeypox remain immune to disease?
I don't think we know yet. Again, we're the situation we're in now is many more people having monkeypox at one time than we've ever had in the past. So that's what's new about monkeypox, is that we have so many people having it right now. And so I think we will understand and learn more in the coming weeks about how long immunity lasts, especially after an infection from monkeypox.
Okay. Somebody would like to know, what is adequate cleaning of dishes and linens? Is there
So
any recommendations?
yeah, so there is guidance on the CDC website for that. The good thing about this virus is that we don't really need to do anything special to kill it. We can use our normal processes, normal disinfectant agents and things like that for getting rid of it.
Great. That's a relief. Are you seeing anyone with large boils after the pimple-like phase?
So I think that it is important to recognize that this virus, first of all, can affect different people differently. So I am aware of some patients who only had a couple of lesions, and then some patients who have many, many more lesions. And what goes into that, I think we will learn more about why one person might have a bigger rash while other people might have a smaller rash. I think the other thing is that we know that the virus and the rash does go through stages. So it might start looking like a pimple, but then over a couple of days might look more like that vesicle. So looks like something that is maybe clear and like fluid filled, but then might grow into like those pustules that I showed. It could be more severe than that, and then eventually into that kind of scabbed over phase, and then eventually that falling off. So I think what we're finding here, again, because so many people have monkeypox at the same time, we're able to really see that the virus can look different in different people, but it does generally go through those phases. And so I think those boils that are being described sound like those pustules those pictures that I showed. And in some people, it could look worse than in other people.
Okay. If someone is experiencing symptoms and does not have a provider, is 211 an appropriate resource?
So I think for testing, it is important to, as I said before, any healthcare provider can test for monkeypox. And certainly there are many people who have been tested in urgent care and emergency rooms. So I think if somebody doesn't have their own healthcare provider, needs to get tested, the most important thing is that they're telling wherever they're going that they need to get a monkeypox test, so that that healthcare provider can be prepared to help them when they arrive.
Okay. There are a couple of questions on here around the stigma pertaining to messaging and communicating about this outbreak. And someone was wondering what might be your best recommendation in how to communicate it so that it isn't being labeled as a gay disease or something that is just with gay and bisexual men.
So I think what everybody is trying to do is making sure that the population that is being affected has all of the information that they need, but at the same time, communicating that this virus can affect anybody. And so it is not necessarily something that other people can ignore. They need to be aware of it and concerned about it so that they are, aware about the symptoms and things like that. And so that we can support everybody that has monkeypox right now. But again, be aware of it, because unfortunately it could spread to other people.
Somebody asked if we're aware of the rate of increased incidence among heterosexuals. Has anything come out about that?
In short, no. I think based on the information that CDC has been able to obtain from the cases so far, again, it doesn't seem like it's changing or that it's spreading outside of the men who have sex with men, networks. But obviously that's something that people are keeping a close eye on.
Okay. So given the history of monkeypox outbreaks in the past, are there any strong contributing factors to explain the reason for such a large outbreak?
So I think there's a lot to learn about, how this outbreak started, as well as when it started. I think there is some concern that maybe monkeypox was spreading, but before people really realized that was spreading because, we of COVID-19 and things like that. So I think we still have a lot to learn about why it is spreading the way it is now. But that said, I think what we do know now is that unfortunately it is spreading. It's especially spreading in men who have sex with men, bisexual men, and other men who have sex with men. And so we want to make sure that we're getting the information out and trying to protect that group in particular as much as we can right now.
Excellent. Pertaining to transmitting the virus, somebody would like to know, what's the risk of flying or taking trains, public transportation, and is there a recommended disinfectant to use?
So far, so I can tell you that CDC does notify states when they find out that somebody with monkeypox was on an airplane when they were infectious. And so they tell us about people who could have been on the airplane who could have been exposed to that person. And so far, nobody who has been exposed in that situation has gotten sick with monkeypox. So that's really good news. And I think really helps us understand that, or at least so far, again, the respiratory component of this virus right now is not the main concern. It's still a concern and one we have to pay attention to, but the main concern is really that really close contact. And so in terms of disinfectant and things like that, the CDC has guidance for how to disinfect and clean different types of surfaces for monkeypox.
Someone would like to know, what's the most serious complication of monkeypox, and what is the appropriate level of alarm we should have if there are no deaths with this particular strain?
Sure. So yes, we are very lucky that there have not been any deaths related to this current outbreak. In the past, in cases in Africa, there were. So I think everyone is very happy that that's not the case. I think it's important for people to know that having monkeypox is very unpleasant. People can have pain, they can have itching, depending where the lesions are. They can be very uncomfortable, they can cause bleeding. And so that's really what healthcare providers are trying to manage. And the fact that it lasts a long time. The rash can last 2 to 4 weeks. That's a long time to be dealing with those symptoms and any side effects from those symptoms. So I don't think this is anything that anybody would ever want. And so something that definitely people want to prevent. And I think that's what one of the things people need to keep in mind. And again, to the question before, just because it's affecting men who have sex with men now doesn't mean that that's going to be the same people that it could be infecting in the future.
Got it. Do we know how long the virus lives outside of the body or on other materials like you mentioned, linens, towels, clothing?
Right. So I think just like other viruses, it can live for, a while outside of the body. That doesn't mean that it can cause infection from that. But again, that's the good thing about this virus is that it's pretty easy to kill with just our usual cleaning activities that we're already doing.
How is information being shared with the Latino Hispanic population?
So I think we're trying our best to identify resources in other languages. We've had an infographic ourselves that Dante worked on in Spanish to at least try to get kind of basic information out to folks, but it's definitely a priority for us, just making sure that we're offering materials in other languages, especially Spanish.
Great. And just going through a couple more of these questions. To be clear, the vaccine requires informed consent. Is this true?
So the Jynneos vaccine, which is the vaccine we are currently distributing, does not, unless the person is under 18.
Okay. For people who have lesions, are there risks in showering or being in water? Thinking about swimming or being in pools, has there been anything documented about it spreading that way?
I don't think so. I think the main concern in those, because again, just thinking about the virus would get diluted by the water. I think the concern in those situations, because I am aware of outbreaks that are related to like bathhouses and saunas, is the sharing of towels and those types of things. Those I think would be the primary concern, not the water itself.
Okay. Yes, and to that point, somebody else just mentioned, should individuals be concerned about large social settings such as bars? And if so, what kind of support could be given to these spaces to make sure that we protect the staff that work in these spaces and the community at large?
Sure. So I think, in terms of large gatherings like bars or even larger, because I see there's a question about, people going to places where there's lots of people like Provincetown and Fire Island and things like that. So I think again, the main concern is that really close, prolonged, intimate contact. So this is not just like walking by somebody and like touching their arm. This is like being with somebody for a prolonged period of time, like we're doing when we're having sex with somebody, right? So I think that's the kind of thing that is really what is spreading this virus. And so that is really the important thing, not necessarily being in a place with lots of people, but having close contact. So again, meeting somebody in that place that then you might go and have that more intimate contact with them. However, I think the thing that we need to keep in mind with this, because I'm seeing another question about, okay, well, what about people understand the rash is infectious, but what about when people might be feeling sick but don't have the rash yet? And I think this is where we need to go back to everything we learned from COVID-19. And if you're not feeling well, you shouldn't be going out, right? Because even if you don't have monkeypox, you could have something else like COVID-19. COVID-19 is still spreading. So I think that is the message that I'm hoping we all kind of continue with COVID-19 that really applies to other things. If we're not feeling well, we shouldn't be going out. We shouldn't be going to school. We shouldn't be going to work. And that's going to protect everybody.
Right, definitely. I just would like to make mention for everybody on the call, we had extended today's webinar until 2:30, so there are 3 minutes left. Any questions that are not answered right now with Dr. Lynn Sosa, we will be gathering all of these questions and putting the answers on the Monkeypox website when we post the webinar and the slides as well. Someone had a specific question. If a person with diabetes and delayed wound healing has monkeypox and the lesions are not healing within 4 weeks, do they need to continue to isolate for as long as it takes to recover?
I mean, in short, I think that is what people need to be working with their healthcare providers on in terms of what they need to do and how to, help them get better. So this is another place where, especially if someone has other medical conditions, that is a situation where their healthcare provider might consider giving them or trying to get the TPOXX medication, which we do have available for folks. So I think it's really important that if people have other medical conditions, they need to be talking to their healthcare provider about what treatments are available to them.
Okay. And for people who have communal living, there's somebody who's concerned around, and I think you touched on this a little bit earlier too, if they live in an apartment and they don't own their own laundry machine, are they at any increased risk in using the same machines as somebody who has monkeypox and used that same laundry equipment?
No, I think the risk we would be concerned about is, say, a roommate doing the laundry of their roommate who has monkeypox. That's a situation we don't want to happen, because we don't want that roommate who is not sick to handle linens that could expose them to monkeypox. So that's really what we're concerned about, not so much the machine itself.
Great distinction. And I think we have time for one last question. It was pertaining to pets. I know that you mentioned small mammals. Would people see any sort of symptoms like small lesions on their pets if somehow they were exposed?
Right. So far, I'm not aware of any pets in the United States getting monkeypox, but it's something that people are monitoring. And I will say that we have information available on this. So I can't. My expectation is that it would look similar, but we can provide more information about monkeypox in pets.
Okay, awesome. Thank you so much for taking the time to meet and present to everybody. This has been a wealth of knowledge, and I'm excited to put together this video recording and all of the rest of the questions, and we'll get those answers to everyone. We'll have them posted, like I said, on the Monkeypox webpage, along with the slides from today's presentation as well. Just want to make an announcement, let everyone know that this is a piece of a webinar series that we're putting together, and to be on the lookout. We have some future presentations around monkeypox with treatment, monkeypox and prevention, and monkeypox with stigma. And so we will be sure to be promoting those when they come out. But thank you so much, everybody, for coming. And thank you again, Dr. Sosa and Dr. Juthani, for speaking today. And we will see you all later.
Thank you.
Thank you.
Thank you, everybody.